Welcome to the Family Birthing Center. I'm Yvonne O'Brien Evans, Chief Nursing Officer at Pella Regional Health Center. We're so proud to welcome people to our new obstetrical unit here. We have named it the Family Birthing Center so that we can be sure that people know we're including families in this experience. That's a big part of what we want to do when mothers arrive to our unit. We have spent a lot of time in the thought and preparation for the design of this unit. We wanted our lobby to be warm and welcoming, and you can see the rotunda here with the soft lighting, and that was done so that this will be a nice, calm environment for mothers and families when they enter. We have a welcome desk that will be staffed with our volunteers so that throughout the day and evening hours, people will be welcomed by one of our Pella Regional volunteers. Any questions that they have can be answered by the volunteer, and they can welcome them and allow them access into the unit. Our unit is very secure, so it is locked throughout the day and with secure access for our mothers and babies. The waiting area was much larger than what our current waiting area was in our older OB department, because again we have families in mind here. There is a lot of space so that people can spread out. There are two sides in the waiting area so that families can be separated if many times we have 2 or 3 families that are waiting here, and so they can have some privacy to spend time with each other. Out here next to the elevator, we have a stained glass feature that we're very proud of, and this is a donation from the Westerkamp family, and this is our Angel of Hope, and this is something that is very special to the OB department. We have our viewing window, which we also did not have in our previous OB department. This viewing window allows families access to see the newborns, and that's something that's pretty special, especially for the little brothers and sisters. And so they really do enjoy that, and there's a step up so that they can see into the window. Now we're going to access the labor and delivery area, and I'll introduce you to our manager, Karen Westerkamp.
I'm Karen Westerkamp, and I'm the OB manager at Pella Regional Health Center OB department, and I'm going to introduce you to one of our new labor and delivery and postpartum rooms. We moved to this area about 2 months ago, and as you can see, the rooms are very good size. One thing that was very important to us as we designed each of the labor rooms was to hide as much of the medical equipment as we could, so that when patients come in, that it's more of a home-like feeling. So behind these cabinets are everything that we need for delivery or for emergencies for the mom. This is the mom side of the room. The nurse's side is to the right. Over here behind this closet is where we keep our baby warmers, and we try to keep a warmer in each of the labor rooms. We pull this out when it's time for delivery, and then use it until the baby is stable, and then remove it from the room. The other nice feature of our rooms is the bathrooms. Down in our old department, patients shared whirlpool baths. In the new department, each of the rooms have their own whirlpool bath, and we are finding that more and more moms are using them during their laboring process, and of course after they deliver their baby. Currently we have 7 labor delivery, recovery and postpartum rooms, and 3 postpartum rooms that we use for our C-sections. And this fall we are going to increase the number of postpartum rooms to 4. We all work very hard to make sure that you have the best delivery experience possible. The space that we have up here is probably 3 times the space that we had in our old department. The rooms are bigger, which allows for families to come in and to meet their new baby, and just the space that allows staff to get away from it all. We have a break room now. But most of all, I think it's that everybody that works in OB and takes care of our moms and babies have that compassion to make your birthing experience the best possible.